I'm Dr. Chris Doherty. I'm a board certified orthopedic surgeon, fellowship trained in sports medicine at the Agility Center in Bentonville, Arkansas. Here we're going to demonstrate the use of the Novostitch Plus device on a radial split of the medial meniscus. We can see that this meniscus has sustained significant damage in the posterior horn. If we excise this, we're going to end up excising a large volume of the meniscus and perhaps the entire meniscus, resulting in a significant risk of arthritis for this patient. The Novostitch Plus device will allow us to salvage this meniscus. So we're going to first prepare our tear site by rasping it and trephinating the meniscus and ensuring that we have a stable margin for repair. We bring in our Novostitch Plus device. In this case, the joint space is tight, so I did trephinate the medial collateral ligament. You can see a slight opening of the joint here with trephination. This allows me to introduce the Novostitch Plus device, reducing the risk for articular cartilage damage. So we'll bring in the Novostitch Plus, extending our lower jaw. We'll pass a side-to-side suture, first in the deep aspect. So here we go ahead and pass. The needle pushes and retrieves into the upper jaw. And I'm going to move over, still deep, and pass into the other side of the split. So I retrieve both my suture limbs. In this case, I'm not going to tie initially. I'm going to use these as traction sutures to allow me to produce the meniscus anterior and get a better grip for my second bite. So here's our next suture load. We're going to go ahead and pass into that posterior horn. Once we get this pass secured, we'll pass onto the other side of our tear. So you can see we're now going across our tear site. Introduce our lower jaw again underneath the meniscus itself, so you can see us push in, find an opportune spot to place our jaw through and get good position for our second pass. After this, we'll go ahead and tie both of these limbs. And in this case, I passed 2 additional sutures, one back at the capsular margin after closing down the split, and one additional in the posterior horn root to go ahead and close down that horizontal split. This allowed us to salvage this meniscus and get an excellent repair on this radial split of our medial meniscus.